Hello, my name is Sarah of Sarah Hosier Limited. I'm a senior phlebotomist and a phlebotomy tutor. Today I'm going to demonstrate how to take blood using a winged infusion set, otherwise known as a butterfly needle, from the hand. So the very first thing we do is we wash our hands to clinical medical standards. That should be for a minimum of 30 seconds. If we're doing it properly, it really should be taking closer to a minute. Next, I'm going to greet my patient, explain who I am, why I'm there, and I'm going to get their consent. So, good morning, my name is Sarah. I'm here to take some blood from you today. Is that okay with you?
Yes, that's fine.
Perfect. Next, I need to identify him. So we use 3 separate identifiers for every single patient. If we don't use those 3 separate identifiers, we could find that actually we're going to the wrong patient or we're misidentifying as we go. So, in order to identify my patient, I would always ask for their full name, their date of birth, and either their address, or if they're in hospital, I'll take their NHS number from their wrist strap. After I've done that, I'm going to pop my tourniquet on. Now, because we're doing a hand, we're going to pop our tourniquet on just a little bit above the wrist and pull it nice and tight. I'm then going to get the patient to loosely curl their fists, so just a loose curl please. You don't need to, you're squeezing, you don't need to squeeze, just a nice loose curl. Just as though you're holding a bike handle, but just loosely. Then I'm going to have a good feel for various veins on the hand. This patient has great veins on the hand. We always palpate using our fingers, not our thumbs, because our thumbs have a pulse in them. So, I've discovered what vein I'm going to go for, so I'm going to release my tourniquet. So next I'm going to clean my patient's hand. So we just get our prep swab out and just ball it up a little bit, and starting in a circular motion, we start small and go outwards. We want to cover all the potential sites that we may take blood from. We should be doing this for about 30 seconds. And what this does is it pushes the bacteria on the skin away from the site that we're taking blood from and cleans them sufficiently that we have a choice for areas that we may want to perform venipuncture in. Whilst that's air drying, and we do need to leave it to air dry for quite a long time, it can be up to a minute. So whilst it's air drying, I want to prepare my needle. So on the back of our winged infusion set, otherwise known as a butterfly needle, we have a little blue arrow, and this is where we open it from. So we just peel the container, the paper back, to make it nice and easy to pull out. And then you'll have a little bit of plastic which we pull over the top of these 2 needles and discard of it. Now we need to remember which of these 2 needles is the more dangerous one. In this case, it is not the one that goes into the patient. This is covered and quite safe. It is this side which goes into the holder, which has an actual needle inside. So although it looks nice and safe, you can suffer a needle sharp injury from this side just as well as any other. So we pop our holder on and twist it and give it a bit of a push. Because it's an infusion set, these sometimes come off, so I always recommend that you give it a good push to make sure it's on. This is now safe, so we can pop it down and pop our tourniquet back on. So we want to pull our tourniquet quite tight at this point, and just a nice loose fist facing slightly downwards. There we go, you're fine. This is the last chance you have to put your gloves on. Okay. And then I'm going to pick up my winged infusion set, and the bobbly bit is the bit that goes against the patient's skin, and the bit with the 23 gauge writing and BD goes facing up towards the ceiling. That's because that's where our bevel is, and we always want our bevel to be facing upwards. I like to hold it by one of the wings, just so that I can see when I get the flashback of blood in the yellow part. then I'm going to give this a really good twist, because these can be quite difficult to take off. So I want to really make sure it's nice and loose. And then I'm going to skim upwards and into the vein. It's not a steep one, it's just a skimming through the skin and into the vein. Sharp scratch. And we can see I've got some flashback there. So we know we're in the vein. So the first tube that I use, I'm going to pop it in. And because there's air in this tube here, we need to discard the first tube. So once that tube is full of air and we see blood in here, we can get rid of that. Then we get our first tube that we actually want to take blood with and pop that in. And we just wait for it to fill. With the light blue tubes, it's really important that they are full to the fill line, otherwise they will be rejected by the lab. So we need to make sure that it hits that mark. So once that's done, I'm going to take it off, hold it up just to make sure it's full to the dark blue square. And this is, so I'm going to pop it down and get my gold tube and pop that on and wait for this to fill. These always look like they're slightly underfilled because we have all the gel in the bottom here. Don't let that worry you though. As soon as it stops moving in the tube, it's done. Perfect. So then I'll get my lavender following the order of draw. And these can sometimes be a bit slower to fill, but they get there. And with these, the fill line, the square on the side of the label is a white colour. So we just need to make sure we've hit that mark. Perfect. So now we're done, so I'm going to release the tourniquet. I'm going to get my cotton wool and hold it just above the site. So I'm not actually touching the needle, but I'm holding it just above the site. I'm going to pull my needle out smoothly and pop some pressure on there. Now if you can just press on that as hard as possible, I'm going to engage the safety mechanism. So we hold the very bottom of this yellow bit just here, and then we pull down on the tube until it clicks before we get rid of it in the sharp spin. At that point, I want to make sure my patient is okay. And I will pick up my tubes. I've already checked they're full, so I'm just going to do my inversions. So that's all done. And much the same, I'm going to apply as much pressure as I can to the site to try and stop any bruising, and we can see that it's nicely stopped bleeding, and also we can see that there's no sign of bruising at this stage. So I'm just going to pop that back on and apply a little bit of tape. I prefer tape to plasters because it's not so damaging to the skin. And there we are, we're all done. Thank you. Thank you for watching my video. If you'd like to learn more about the services that I offer or to see more of my videos, then please visit my website www.sarahhosier.co.uk. Thank you.